ಒಂದು ನಿಮಿಷ ಕನ್ಫರ್ಮ್ ಮಾಡ್ತೀನಿ ಲೈವ್ ಆಗ್ತಿದೆಯಾ ಇಲ್ಲ ಅಂತ. ಲೈವ್ ಆಗಲಿಲ್ವಾ?
ನೋಟಿಫಿಕೇಶನ್ ಬರ್ಲಿಲ್ಲ ನನಗೆ ಯೂಟ್ಯೂಬ್.
ಸ್ವಲ್ಪ ತಲೆ ಕೆಳಗಿಳಿಸಿದ್ರೆ ಆಗ್ಬೋದು ಅನ್ಸುತ್ತೆ ನೋಡಿ. ಹ್ಮ್ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ. So, namaste to all. So, today we are doing an podcast on what exactly is Indriya Arogya and what exactly a team should be doing in Ayurgrama 3.0. So, after watching this video, you will be able to understand what exactly you have to do and what is the vision of the organizers. So, myself, Dr. Sharad Kumar, founder of Aptas Ayurveda, and we have even Dr. Kiran. So, he is also one of the founder of Aptas Ayurveda and trustee of Aptas Ayurveda. So, so this meeting will be kind of asking questions and sharing each other's thought. So first I will be asking questions to Kiran. So Kiran, so what according to you is Indriya Arogya?
So, hi, Sharad, Dr. Sharad, and good evening, everyone. So, when at this point of time we are discussing about the theme, I'm remembering few days ago I had done a video about before the launch of this program. We had done a video, recorded a video. In that, just discussing about um, um, the hype for this program, that is Indriya Arogya. Like many people, when we published that Indriya Arogya program coming soon, then that hype was created and many people started asking about this. So that is one thing I want to mention here. So that theme has caught the eyes of the spectators because it has that significance. This is the first point. And as we all are Ayurveda, we belong to Ayurveda fraternity, and our basic principles, Ayurveda basic principles, will cannot be explained without the concept of Indriya, right? So we study about what are Indriyas and how they involve in the in this process of jnana so from that perspective, also the Indriyas has a very significant role. And in our daily life, how our Indriyas help in our daily life, we all know that probably we know I can say lesser than what we should know, because as always I discussed with Dr. Sharad. Sharad used to give one example. Just imagine if we are not having eyes or if we are not having ears, then our perception is blocked. So we can't even imagine how indriyas are important in our day-to-day life. So it could be the Chakshurindriya, Shravanendriya, Ghanendriya, and Jihva Indriya, and finally the Twak. So all these Indriyas have a significant role in perception as well as easing our day-to-day life activities. So that is a very important point. Why we have to focus on the Indriya health. So, so I think this is an important point. We have to not only a medical fraternity, common people also should think and protect the Indriya. So that is why this game is important. So what I feel.
Yes, Kiran. So as you rightly said, so Indriyas are very important, and you have covered what Indriya Arogya is. So I also want to add some points to your thoughts. So, as the definition of Ayu in the word Ayurveda says, Sharirendriya Sattvatma Sanyogo Dhari Jivitam. So, the word Ayu is having four components, means the life itself or the human being, human life. This has four components which are very important as per Ayurveda, and they are Sharira, Indriya, Manas, and Atma. So, but these days we give a lot of priority for Sharirika Arogya. We give a lot of priority even for Manasika Arogya. But when it comes to Indriya, I think we are lacking. That doesn't mean that we are not aware of Indriya Arogya. So I can claim that in everybody's childhood. So if you go to any communities or any part of India, so in the childhood of a kid, so they have performed all the therapies required to protect the Indriyas. For example, you can see every kid, so in their childhood, will be applied with the Anjana, that is to protect the eyes, and the Abhyanga will be performed 3 to 4 times in a week for all the babies. So that is to protect the skin, and even the Karana Purana has been done. So much of care has been taken in our childhood for protecting our indriyas because it is part of our culture. But as we grow gradually, so somewhere we have forgotten our roots, and even in the Ayurveda colleges, in from first year we will study about Indriya Arogya. So the Dinacharya Adhyaya itself give lot of priority for Indriya Arogya. They have mentioned about Anjana, Karna Purana, Nasya, and for oral health, for the protection of Rasanendriya. They have given lot of inputs, including Danta Dhavana, Jivha Nirlekana. Everything is supporting for oral hygiene as well as oral health. But we have forgotten those things, what has been mentioned by our acharyas. The Abhyanga has lot of relevance. Pada Abhyanga, Shiro Abhyanga, everything is for Sparshanendriya as well as whole Sharirika Arogya. It has impact on Indriya as well as Manas also. And there are factors explained about Nidra, which is also supporting for the Indriya. So when so much of things has been explained in Ayurveda, in most of the Ayurveda colleges we just teach them, but we ourselves are not practicing this. And this is the thing which made us, the Aptas team, to think and bring back the culture of Indriya Arogya into everybody's life. That's why this is not just an event or contest. Indriya Arogya is a 5 years project where Aptas Ayurveda will be continuously working to convert this Indriya Arogya into a public movement. So public movement will take place when people get awareness about it. So this has to start from the Ayurveda colleges is what we have understood. So this year we thought with the Ayurgrama 3.0 to keep Indriya Arogya as a theme, and we want to see how creatively our Ayurveda graduates come up with ideas on awareness as well as creating awareness about Indriya Arogya. So this is the thought behind Indriya Arogya. So, the podcast, as we have mentioned, the topic itself is what should be done in Ayurgrama 3.0, and the theme is Indriya Arogya. So, now I will be asking Kiran. So, please share some of the thoughts on what exactly somebody should be doing after the registration in Ayurgrama 3.
Uh, okay, Dr. Sharad has explained very well about our theme, and to add some more points. So there could be many
So when
reasons
so much of things has been
for
explained in
following
Ayurveda,
the
in
Indriya
most of the
Arogya
Ayurveda colleges we just teach them,
healthcare.
but we ourselves are not
We have to
practicing this.
rethink and reorient ourselves because in Ayurveda there is so much information on Indriyas and Indriya Arogya. There's emphasis on this. Yet, what could be the reasons why it has not been implemented till now? Even though we know the importance of Indriyas, Indriya Arogya, and how Indias are helpful. Okay, still uh, now we are the time has come to think. So I think we should try to identify the nidana for this, and we have to start from nidana parivarjana and then solving the samprapti. And as Dr. Sharad asked about what has to be done after the registration, so we have already we have already launched our brochure, and we have also shared the brochure. So before um, going further, so I suggest all the interested participants or interested students, please go through the brochure. So most of the points are already mentioned in the brochure. So what has to be done after the registration? So the registration has two things. So one is we have sent the registration forms to the colleges. So once the registration form is received, so that has to be duly filled, and then after filling the registration form, then the self declaration form, both the things, then the interested students, once they contact our team, we will be sending the Google link for the registration. So that is the that is how you register your team. And as it is mentioned in the brochure, so this time total 25 participants can be there in the team, including the coordinators, three coordinators. So so that is the structure of the team. So so that means when you want to register your team, you have to set the whole team and then uh, do the registration. This is the first thing. And as this initiative requires planning, okay, and proper execution. Okay. So soon after the registration, the whole team has to sit and plan what can be done in the round one as well as for the round two. Because in the round one will be done as a campus round. Okay, we have given the name as Ayurvidyalaya, and the round two will be the Ayurgrama. So where the round one will be done in the campus itself or in the college itself, taking into consideration that if we are following the principles of Indriya Arogya, then we can implement in the villages or in the population also. So taking that into consideration, the two rounds have been planned. So in the first round has to be done in the campus itself. So the team has to plan the activities for the Indriya Arogya Saptah. That means the 7 days plan has to be planned. Okay, so we have not set any particular schedule or the format that only this format has to be followed for the 7 days. No, we have kept it for the students to plan. So, in order to explore your perspective and your interest and your creativity in planning the schedule. So after that, finalizing, then um, uh, after that, the next round has to be planned. But before that, you need to whatever you have documented, whatever you have planned, you need to execute it. And then after the execution, you need to present the documentation of the same. And based on your work, your documentation, so we will be approving your plan for the further round. So, Dr. Sharad, can you give some more insight about how to proceed with the next step, that is the actual Ayurgrama, which will be done in the village?
Yes. So before going to explain about round two, I have to add some points in round one itself. So many students will be having a thought that what should be done. So what exactly should be planned for Indriya Arogya for 7 days? They might be having this question. So my answer will be for that. So first our priority is to understand Indriya Arogya of the people who are in the campus, that is teachers, students, as well as non-teaching staff. You have to collect the data of Indriya Arogya of all these people. So for collecting data, you can be forming some of the questionnaire, or you can be collecting some of the questionnaire which is already available, which is validated, or if any questionnaire is there about sensory health from WHO, you can take that also. So after collecting the data, you have to analyze the Indriya Arogya of the people. Suppose I am just giving an example. If in a college there are 600 students, including staff as well as non-teaching staff, if the total number of the people in a college is 600, so you should be collecting data from everyone and you should be telling that among 600, how many people are having specs. Suppose if 250 students, including teachers as well as everybody, is having specs, so then you will be collecting that data and you will be documenting it. And you will be also collecting what kind of impairments are there in other areas as well. So with the questionnaire, with the Google Forms or by one-to-one interaction, the 25 members team can be doing that. So after that, you have to plan what actually is required in the name of Indriya Arogya Saptaha. So in these 7 days, you will be doing a inauguration program on the first day, and on the seventh day you will be doing a valedictory program. So on the day of inauguration, you will be presenting this data in front of everyone that in our college, among these many people, we have these many people who are having impairments with the Indriya Arogya, and then how we can improve that, and those who are having healthy indriyas, how we can protect their health of the indriyas. So in these 7 days we are expecting you to collectively practice the therapies which are required for protecting the indriyas, and you can be creating some innovative ideas. For example, Indriya Arogya exhibition, where one class students will be showing about ahara, so one class will be showing about Vihara, what should be done for Indriya Arogya. So many things can be planned. So for that you can be going to the focus areas mentioned in our brochure. So you can work on all the focus areas. So in these 7 days, together you will be creating initiatives to create awareness among ourselves to practice Indriya Arogya. For example, if in a college they decide that for protecting Indriyas, Nasya is very important and they will decide. So among these 7 days, second day is called as Nasya Day. So they can be celebrating Nasya Day, and together for 20 to 25 minutes they might be performing Nasya for everyone in the campus. So this will make everybody to create awareness about Nasya. Or we can be doing other therapies as well. Karnapurna is there, Gandusha is there, and Abhyanga is there. Anything we can be doing. We can be conducting some competitions to make students involved into the activities. So all this work should be done by these 25 people and everything should be documented. So we will be allowing you for doing Ayurgrama once we see the preparedness for your Ayurvidyalaya. So making Ayurveda is very important, and this is really a challenging thing because it requires a lot of convincing for our own people. We have to convince teachers, we have to convince students, and we have to collect the data, and we have to create some IEC materials to create awareness. For example, non-teaching staffs might not be aware about all these things. The staffs who are working in hospital, they might not be aware about some of the therapies. They might be performing to others, but they are not aware how it feels. So there might be teachers who have not practiced. There might be students who have not practiced therapies. So you have to convince everyone to undergo some of the therapies to protect indriyas. So you can be conducting so many competitions like reel making competition, short film competition within the college to create awareness about Indriya Arogya. So many creative things you can be doing. The whole focus should be to understand why people are not ready to follow Indriya Arogya. Being doctors, being studying Ayurveda, why we ourselves are not practicing the Indriya Arogya. So what is expected in the end of Indriya Arogya Saptaha is to collectively take some behavioral change, impactful decisions. So our Guru B.S. Prasad sir was giving an example, Dr. Kiran. The sir said that in a village People collectively decided that after 8 p.m., nobody will be using the mobile in the village. So when people decided like this, the reason was to have different connections with each others, and even the kids, the next generation will be not forcing to use mobile in the village. So with this good thought, a collective decision was made. So we want such behavioral change initiatives within the campus. So for example, if a college decides that every week one day we will be keeping for doing Nasya, and within the campus we will be applying just Pratimarsha Nasya. This is a very good big initiative a campus can initiate. So we can make some mobile free zones where mobiles are not allowed. So that is also for protecting Indriyas, that will reduce the screen time. So we can create so many such initiatives like we'll be not using mobile for a whole day. That's kind of digital upavasa to keep away ourselves from mobile, because continuously using mobile can harm our Indriyas. So we can think of all the nidanas which will bring the diseases or which will be causing the problem for Indriyas, and how to prevent from that is the important. In hostel mess, we can be adding the food which will help in nourishing the Indriyas as a menu. So many creative initiatives you can be taking, and when you yourself involve in these activities, then it will bring a impact. So you can be planning once in a week for 5 to 10 minutes. We all will be doing eye exercise. So, like these initiatives we want in the campus. So, when our people start practicing Ayurveda within the college, this will bring a lot of change. So, when you do this Ayurvidyalaya properly, definitely we will be helping you to go for the Ayurgrama. And once you are trained, you will be doing it easily in the village also. So you have to develop IEC materials, that is information, education and communication. Like you have to prepare some books, you have to prepare some posters, you have to prepare some pamphlets to educate people on this information related to Indriya Arogya. You can be creating animated videos, you can make some short film, you can be planning some skits, street plays you can be planning. So innovatively you can create awareness about Indriya Arogya and what are all the Nidanas which are creating problem. For that also you can be creating IC materials. We have mentioned something called SOP, that is standard operating procedure for all the therapies which are explained for the Indriya Arogya. So SOPs can be made, and we can also prepare training modules. Training module is required when we want to teach these therapies to practice within the home for someone else, then we have to have a training module, that how we are going to train people on practicing Indriya Arogya. So these are the thoughts behind Indriya Arogya within Ayurgrama 3. So we are seeing lot of students are interested in this. Many students are framing the teams within the college, and they are very much enthusiastic about doing this. So the first step after registration will be to discuss with teachers and gather the knowledge on what can be done. For that you can be using all the samhitas. You have to gather all the information already available in samhitas, and for assessment parameters you have to check the Google that is there any already assessment parameters or questionnaires are available for the sensory health. If you want to create, then you might require time to validate the questionnaire. So how best we can assess the Indriya Arogya. So lot of things are involved in this, and this is how you have to start working for this. You can be selecting different focus area. We have planned very well about focus area. You can be studying the rasayana required for Indriya Arogya. So you can be planning food required for Indriya Arogya. You can be planning the lifestyle, the vihara, what should be performed to protect the Indriya Arogya. So many things are mentioned, and there are already some practices in the public. So you can also document those things when you go for Ayurgrama round. So this is what we are expecting as an organizer, that within the Ayurveda colleges, our Ayurveda students should start practicing Ayurveda, because we always have a habit of preaching others, and we should be walking the talk. So there is a saying, one should walk the talk. That means whatever we say, we should be practicing. Even we as an organizer, we also know we are also not good enough to practice everything, but we have started implementing so many things day by day. So for example, to tell about myself, I have started practicing Nasya, Pratimarsha Nasya since 2 3 weeks. I am applying Pratimarsha Nasya every day. I am using Dantadhavana Churna itself for brushing my teeth. So I will be performing Abhyanga once in a month at least. So these are the gradual changes we are bringing. So we want all the youths to take this initiative in a bigger way. Because if we directly go to public and ask them to follow these things, it is very easy for them to say and laugh that you yourself are not practicing. So we want to create a different module where we can show that we are also practicing, we have practiced these things. So with that experience, we are telling you. That doesn't mean that the results of what you have practiced will be seen immediately. It might take time, but this is the behavioral change. And in Indriya, we can also include Manas because Ayurveda said Indriya, Manas also has Ubhay Indriya. And we are working on the behavioral change. We want people to change their thoughts, and it is not so easy. So Indriya Arogya, if you want to become an Abhiyana, it requires lot of things. For example, Swachha Bharata is an Abhiyana where our Prime Minister Narendra Modi ji motivated so many people to take part in this, and after that Abhiyana, people have been educated, created awareness about not to litter here and there. So, to just bring a change in the thought, so much of awareness is required, so much of funding is required. So, this is just an initiative we have started from Aptas Ayurveda in this year. So, within 5 years, we want to convert this into a movement. We want to reach different peoples, we want to reach them and we want to educate them on Indriya Arogya, and this cannot be possible without the support of the young Ayurveda leaders as well as students. So I have seen that participation in Ayurgrama 2, it has created very well impact, but still the focus was not there in that also. So it was a very general Ayurveda theme we have practiced and preached in the villages. So but this year we are very sure about only one topic, that is Indriya Arogya. So please start studying about Indriya Arogya, discuss with your teachers. You can take help of expertise in Shalakya. You can take help of expertise in Panchakarma because they will be knowing how to develop SOP and training module for these therapies. So they will be guiding you how to perform Nasya. You can take the expertise of Samhita people. You can also take the expertise of Swastharutta department because the whole event itself is a preventive aspect. So with the help of all your teachers, please gather the knowledge and develop a module. You can also be publishing a book on the thoughts what we have shared in the focus area. You can use that as an index and you can write a book in Kannada, English, Hindi, any language you desire. So publish the book from college. You can sell that to people and you can gain money from that, and that you can use for doing the Ayurgrama. So many thoughts are involved. You can start promotion in social media. You can start talking about your lifestyle after using Indriya Arogya thoughts. So these are the thoughts behind our Indriya Arogya. So this is just Indriya Arogya. We have to add Abhiyana to this thought, and to add Abhiyana thought is not so easy. So still we have announced and we are extending one more week for registration as we could not reach so many other colleges in other states. So our coordinators are going to many colleges and they are motivating students as well as staff to take part in this. So this is how we are expecting, and this is a humble request to everyone to take part in this. And without your support, even Aptas cannot do anything, is what we believe. So with your support only, we could reach many people. So all those who will be watching this video, please understand the thought process behind Indriya Arogya. So with this, I will ask Kiran. So what more creative ways can be included for students to practice Indriya Arogya? What are your thoughts?
Okay, any points are already covered while Sharat sir was explaining about it. So even I have the most of the similar thoughts about it. What I feel is in this era we have our focus is the Mithya Yoga and Ati Yoga of our Indriyas. So when we were kids, when we were young kids, so our parents used to tell us not to watch TV much. So there was a time restricted for watching the TV. But unfortunately now many people are having the smartphones, and there is no limit for this what we call it a screen time. There is literally there is no limit anytime, and every time we'll be seeing the screen, and definitely it is going to affect our indriyas. So we have studied about Indriya Pradosha, Vikara, Supatapa, Upaghata. It's all theory we have studied, but we have not applied that to our practice. So it is when our screen time is more, it is clearly saying that it is Indriya Atiyoga, or also Indriya Mithya Yoga. Because our eye has to work more, and our eye has to process more. So definitely, just if we start thinking about it, we can also get many more thoughts about how we can solve this problem. So this is just an example how we can start or how we can initiate our thinking, and how we can plan the Indriya Arogya Abhiyan. So just I gave the example of the screen time I. So students can specifically plan something related to how we can avoid this Ati Yoga and Mithya Yoga of Chakshurindriya specifically. And comparing the five Jnanendriyas, we see more problems related to eyes compared to other Indriyas. Eye or some second to it is the Shravanendriya. But regarding the Granendriya and Jikvendriya and Sparshanendriya, uh, we may not get much thoughts how we can protect those indriyas also, because our understanding of Mithya Yoga or Ati Yoga of those indriyas are very much limited. So when we are living in this modern day world, um, uh, definitely there is a chance that we always miss, even in our practice, we always miss about these three indriyas. For example, the sensation, taste sensation, smell sensation, touch sensation, it is very rarely asked, or if you are a practicing doctor, you may not have asked any patient about specifically about these indriyas. So definitely we have to explore more these three indriyas also, because we have seen a situation where there was a pandemic, and many people had this problem with the sensation of
No.
smell or sensation of taste after that pandemic. Then only that thought came. Okay, so there is a virus can cause problem with the indriya. So, so just like when there was a problem, then the people started thinking about solution. So, what is our responsibility is we should not wait for some problem to happen and then find a solution. Prevention is always better than that kind of a situation. So, with that perspective, also you can plan many things how we can prevent these indriyas from being damaged by any of the different type of diseases. So preventive aspects, we can the students can plan many of the activities. And when the students assess about the indriyas, for example, when you are doing a survey, so you can get some idea about the functioning as well as dysfunction of the indriyas. So in a population, in a group of people, you can get an idea that how many people are affected with the problem with the indriyas, because that will tell you the seriousness of the problem. Now, many people can think, what is there in this? It is in the daily life, everything we do many things. These are all part of life. Like such a way, also people can think. But if we just see in our classrooms or in a group of people where generally we deal with, so we can see many people with the spectacles, right? So it has become a normal. But basically we have to ask this question whether it has to be normalized. No, we have to prevent the problems that are pertaining to Indriyas. So likewise, identification of the problem and then planning the different things, how we can prevent that problem and how we can solve that problem. So with this perspective, students are thinking. I think students can get many thoughts, many different creative plans can plan the Indriya Abhiyana as well as for the Ayurgrama. So, so these are my some of the thoughts on how students can think and proceed.
I think Kiran, even we can make the students to innovate things to practice Indriya Arogya therapies as well as also the assessment tools also can be developed in this Indriya Arogya Abhiyana as well as Ayurgrama 3. I just want to share an example. So recently I happened to be in healthcare summit in Hyderabad. So, and in that summit, I saw a doctor presented about a device, and the doctor is from LV Prasad Eye Hospital, which is a very big hospital working for the eye health. This is based in Hyderabad, and they have a very huge network, and they are working in rural areas as well. So, we have to also think that we should not be only focusing on the urban population, but we have to cater these Indriya Arogya thoughts into the rural people, because already they are aware and they are practicing many things, but gradually they are even shifting from that lifestyle to the urban lifestyle, which is not a good thing. But coming back to the point of what the doctor was sharing, they have innovated a device called folding phoropter. So this folding phoropter is useful in checking the refractive errors in the people, and that costs only 400 rupees, and it is made out of paper. It is just a paper foldable box, and where you have to apply some lens, and by changing its movement you can assess the refractive error within no time. So such an innovation has been done which is easily available to everyone. So there are so many such tools even Ayurveda graduates can develop for identifying the problems in the Indriyas, or you can plan something to innovate apps which will guide us on Indriya Arogya. There's a chance that our students can do that also. So these days with the help of AI, students can do a lot of things. So we are expecting even such innovations from some team, and those kind of innovations will be definitely rewarded from Aptas Ayurveda. So these are our thoughts, and if you have any questions regarding Indriya Arogya or Ayurgrama, you can contact us anytime. Our whole team is ready to serve you with the knowledge what we have, and this is just the starting of the podcast. So daily for another 10 days, we'll be having different guests who will be sharing their thoughts. So we'll be calling experts from Shastra. We'll be calling experts who will be guiding on how to develop SOP and how to make questionnaire. All these things will be guided. So this is a collective responsibility from Ayurveda people to take this and initiate a movement within the campus. So when you can convince our own people, it is very easy to convince people from the village. So, and if this initiative works well, we are requesting Ministry of Ayush with the all data and all the works what you have done to support all the teams to take this initiative forward and make it a national movement. So we have Ayurveda Day in September 23, and we can also request Ministry to make Indriya Arogya itself as the theme for this year, because this is high time that we have to worry about our Indriyas. So I felt very bad when in my class I asked students, those who are wearing specs, please stand up. I was shocked that 50% of the class was wearing specs, and I went back to the past and I thought if these students would have been educated about doing Anutaila Nasya in their childhood, maybe they wouldn't be wearing the specs at this age itself. Imagine in first year BAMS, students will be having specs, and by the time he leave the internship, there also will be having the same issue. Being in an Ayurveda college and hospital for 5.5 years, if we could not help our own people to get rid of the specs or to guide about Indriya Arogya, then I think we as a system are failing somewhere. This is not a blame on anybody, or this is not to blame the system itself. We are also part of the system, and we have to take a lead, and we have to initiate things to bring the change within ourselves. So with this motive, Aptas Ayurveda is continuously having thought process. We are meeting different experts. We are trying to meet. In January itself, we has proposed Ministry of Ayush with the idea of Indriya Arogya, and they have responded well, and they have also thought that we can include this under National Ayush Mission. So government is also ready to support, and our NCISM, which is looking after all the colleges, they are also in support, and in another day they are giving logo support, and they will be also helping us to reach all the colleges from their side. So we are also extending the dates as per the convenience of the students, because in North India I came to know that there are summer holidays and many college students are in vacation. Because of such things, we have to extend the dates, and definitely we are ready to help each college, each student to plan and participate in this Indriya Arogya. Even though it might be a competition, the thought process is very visionary. So we will be also sharing the project on Indriya Arogya, which we have made recently and we have submitted to ministry. So we'll be sharing that. So please gather. And when you go for urban public, they will be asking the evidence. So we have to also create evidence. We have to create data. So the long-term thought we have is, in the schools, Indriya Arogya should be a subject. Indriya Arogya should be practiced in our schools in India. So this is the thought, Swastha Indriya, Swastha India. The coming generation should not be wearing specs. Maybe after 50 years, wearing specs becomes very normal because we are excessively using the gadgets. So Indriya Arogya is very important, and in Charaka Samhita Sutra Sthana 30th chapter they have also said Indriya Jayo Nandanana. So we have to win over our Indriyas. So here Indriya is not protecting the health of the Indriyas physically by doing therapies. It is also linked with the controlling of the Indriyas. We have to train ourselves to better control the Indriyas. For example, to give my own example, I have very difficulty in controlling Rasanendriya. I am fond of different foods. I like to eat so much food, so many varieties of foods. So if I do that, that can lead in future with the stolya, or it can bring santarpanajanya vyadhis. So I had to change my behavior regarding rasanendriya. So this is the thought behind Indriya Arogya. It is not just doing some therapies and protecting the sense organs in that physical way. It is also to bring change in our mind to control Indriyas. So if we can succeed in this, definitely we all together will be creating a history that Ayurveda students themselves have taken a lead. I always remember our Prime Minister Narendra Modi ji's word. So Narendra Modi ji say that we should practice Ayurveda. We should not be simply preaching it. We have to practice by ourselves, and this is why we have brought a change in the pattern of Ayurgrama. So previously, directly students used to go for village and practice these things and preach these things. And at that time, many people have asked, what will happen in a week if you go and tell these things in public? So then we thought changes will be within. So for that we have introduced this round one called Ayurvidyalaya, and definitely this is a fun part, and you will be enjoying the process to know about Indriya Arogya, ourselves and our own people. So please start making your team and start registration. So as per the previous date, tomorrow is the last day to register. So as much as team if get registered tomorrow itself, our team will be helping you to plan everything further. So we'll be in continuous touch. We'll be adding all the students in a particular group, and we'll be continuously monitoring them for doing the better betterment of Indriya Arogya within the campus. So we have a lot of hopes as an organizer because last year 82 teams have participated and 82 villages were benefited. But last time we have allowed two teams from a single college, and like that 20 colleges had two teams and we could get 40 teams from these 20 colleges itself. But this year we have restricted for one team, as you have to make the best possible team in the college. You should not be quarreling among yourself with two teams. So make the best possible team and initiate Indriya Arogya within the campus. Convince our own people and enjoy the process. Present the data. Take suggestions from everyone. That doesn't mean that 25 people are participating. They have to do everything. You can take suggestions from all the teachers. You can collect information from all the students. So this is a collective work. So I see as a vision that all the Ayurveda colleges who are taking part will initiate something in the college to practice Indriya Arogya. So Dr. Kiran, you want to add anything as a part of vision? What you are expecting from the teams? What changes you are expecting?
Yes, Dr. Sir, as you rightly said, should not normalize the problem. And so I think when we take something into serious consideration and practice it, then only the good results will be manifested. So we call it as abhyas. When we are doing it on a regular basis, we'll definitely get to see the effects. So in the Samhitas, many things have been mentioned, but we really have not gone through it. We really have not experienced it. We have not explored it. Now I think it is the time to explore more about Indriya Arogya through proper understanding of Indriya Arogya, what is the problem, what could be the solution, and how we can experience this through various means, various focus areas. So I think it is the time to implement whatever we have been discussing till now. I would like to add this one point, and I would like to wish all the interested students to take participate in this event and experience the benefits of Ayurveda through the Indriya Arogya. So I'd like to wish all the best for the
One more question,
interested
Dr.
students.
Kiran. What
Yes.
a student will be getting if he involve into Ayurgrama 3.0 competition. So what are the benefits he is going to get? Because generally students will be having that why I should participate, what I will be getting. So what are your thoughts on this?
So one thing I can say is when we have formulated the team, there are different areas. For example, in a team, there will be a team head, and when a plan has to be executed, there are different levels or different things we have to focus in. For example, we have to think about the whole plan execution, the transportation, the finance, and the documentation team, could be photo, video documentation, and many other areas we need to focus, right? So, like in this Ayurgrama theme, as conducted in the previous two terms, also there are different roles in as the team members will be assigned. So the team members can, based on their interest and expertise, they can participate and they can show their talent. They can explore their talent through the different roles in the team. For example, if a person is very good at taking photos, videos, the person can involve in the documentation. So definitely it's a learning as well as an experience for the students to involve in different roles. There is one benefit from this, and another benefit is the students will come to know how to plan projects, right? Because we are doing it in the two rounds. So when we are doing in the campus in the college, it is limited to the 7 days. So in the 7 days, how in a better manner we can conduct the programs and how how we can assess the findings, how we can get the data of the outcomes. So that is one benefit the first student can experience. Third one is second round the student will be going to the villages and then interaction with the public and implementation of the programs will be done in the village. So there also students can communicate with people, common people, how better we can convey our idea, our Ayurvedic principles to the villagers because they are common people and they will not be knowing about the technical terms. And for a student who has studied in class, who has listened to the lectures, then in a real life situation, how in a better way, how we can convey our principles to common public. So that way also it will benefit the student to improve his or her communication skills. So overall, it will become a very good experience for the student. And I can surely say that those who have participated in this program will be definitely benefited by many things when we compare with other students. So when when we are talking about benefit, motivation is also benefit. So many people, many students, they may have come to this field by interest or not, but after coming here, they get motivated and they start doing some new things or they plan new things for their future. Definitely, this program can motivate students into maybe preventive or curative health regarding Indriya Arogya, and definitely students can take up this into another level. And in future, when they go to their practice, they can definitely implement this in a better way also. So these are the different areas where where the students will be benefited. So I think students will definitely be this program will be useful for the students.
So, winding up, I will add some of the visions I have. So, you might have seen that we are celebrating World Kidney Health Day and World Diabetes Day. So many things are there, but I astonish why things are not being done in Ayurveda. So, we can be also having a Nasya Day, we can be having a Indriya Arogya Day. We can also celebrate so many such things. We can introduce our therapies into the world forum in that way. So now in another 2 days we are having World International Yoga Day. International Yoga Day we are celebrating. So I always think that for 2 weeks in all the Ayurveda colleges we are practicing yoga as it is mandated by government. So we are practicing for 2 weeks and we keep 1 hour daily for that. Whereas our own treatments, therapies, what has been taught in our college, we never practice. So the whole vision of Indriya Arogya is a very different thing. So we want government to celebrate our own days. We have so many such concepts in Samhita which can be taken into the society. And this is the vision on which Aptas Ayurveda is working on how to take things what we study in Samhita to the society. So this Ayurveda, Ayurgrama as well as Indriya Arogya is all just part of this, and this can be succeeded only with the help of others. So all those who are watching this video, I have a humble request to reach the brochure, the poster, as well as all the information about Ayurgrama 3 to all the colleges. So if you are a student, please make a team. If you are a teacher, you motivate students to make a team. And if you are a practitioner, you can send these details to your college where you have studied and you can request the principal please involve into this activity. We want at least 100 colleges to take part in this. Then only we can use this data and we can be motivating ministry to work on this and to look into us. So we are also expecting to reach our Prime Minister Narendra Modi with this thought of Indriya Arogya. So all your work, what you have done, we will be taking it into the ministry and we want to take it higher and higher. And this is a humble request to request all the colleges to please register and motivate students and let us work also on Ayurveda and not just on yoga. Yes, as an Indian knowledge system, we have to respect yoga, and I totally support for that. But Yoga Day also can be celebrated and practiced by everyone other than Ayurveda people. It is practiced by everyone. But for Ayurveda treatments, only a Ayurveda doctor or somebody who has studied Ayurveda only can take this to the public. Nobody else can be involving into this. So first we have to practice, then we will be going to people, and we have a lot more thoughts to introduce Indriya Arogya package in all the available Panchakarma therapies. So all those practitioners can start Indriya Arogya packages. Once in a week, I can be visiting some Panchakarma center for my Indriya Arogya. So like this, we can initiate so many things with the Indriya Arogya. So I humbly request everyone to make your own involvement, and those who are practicing and they might be thinking how we can involve, you also can start practicing Indriya Arogya for yourself. And we also require sponsorship in terms of giving prize and so many other things. So once we get the details of the teams registered, we'll be asking different people for sponsoring also. If anybody wants to sponsor as much as they can sponsor for Aptas Ayurveda. So with these words, today I thank Dr. Kiran Bhatt to join for this podcast and share his thoughts. So daily we'll be inviting different guests and we will be discussing on how we can take this into a bigger level. So with these words, I give an end to this podcast. Thank you all for watching, and please join hands with Aptas Ayurveda.